All right, very good. So we have completed item 10, a great event. Let us proceed to item 11.
Thank you. Item number 11 is another exciting proclamation and well-deserved proclamation recognizing National Public Health Week 2022. Cami Bremer, Vice Chair, Board of County Commissioners, and Lojinos Gonzalez, Commissioner, Board of County Commissioners.
Commissioners, please proceed.
Thank you. I would like to move the following proclamation recognizing National Public Health Week 2022. And as I'm reading this, if your team would like to come down. There we go. I move the following proclamation recognizing Public Health Week. Whereas the theme for National Public Health Week 2022 is Public Health is Where You Are. And whereas where residents live, work, learn, play, and worship impacts community and individual health. And whereas a top priority for the Board of El Paso County Commissioners is to promote a thriving community that is safer and stronger. And whereas the mission of El Paso County Public Health is to promote and protect public health and environmental quality across El Paso County through people, prevention, and partnerships. And whereas the vision of El Paso County Public Health is for all El Paso County residents to live in thriving communities where every person has the opportunity to achieve optimal health. And whereas health is an individual responsibility that includes attention to active living, healthy eating, stress management, mental health, and substance use. And whereas El Paso County Public Health continues to meet the needs of the community by forging innovative partnerships and strategies to work upstream to improve these health outcomes. And whereas public health agencies have a responsibility to assess trends and provide unbiased information and resources with respect for various medical perspectives, opinions, and individual choices in pursuit of health. And whereas we thank El Paso County Public Health staff for the hard work and dedication to keep our communities safe. Now, therefore, the Board of El Paso County Commissioners recognizes April 4th through 10th, 2022 as National Public Health Week, done this 12th day of April 2022 at Colorado Springs, Colorado. The Board of El Paso County Commissioners of El Paso County, Colorado, signed Stan Vanderwerf, Chair, Cami Bremer, Vice Chair, Lojinos Gonzalez Jr., Holly Williams, and Carrie Geithner, members, and attested to by Chuck Borman.
Second.
All right, that has been moved and seconded. And Ms. Whalen, it looks like you've got a whole team up there. I'm sure you have some comments.
Good morning, Commissioners. Thank you so much. Susan Whelan, Public Health Director for El Paso County. I wanted to first start off that I'm so happy that we were able to be here for I Inspire because, wow, very inspiring and kind of what, sticks with me from a public health mindset is that the care and compassion and that, we all need help at different points in our lives and those connections and how important those are to building health and wellness in El Paso County. And I view my team as such in the sense that, we work to form partnerships. And, some of what we do is work with moms and babies through our nurse family partnership. And we are kind of like coaches, the public health nurses that are teaching skills and self-sufficiency because we all need help every now and then. And also with our Women's, Infant, and Children program that we serve about 14,000 families, and they need assistance at different points in life to thrive. And we provide education, information about healthy food and nutrition. And we do know that that is so important to living a healthy life, and that's for moms and babies and families as well. So those are so many connections within our community. And public health is not only physical health, it is mental health. And public health does not work in a silo. We could not do the work of improving community health alone. We have numerous partners, and we do have one of our partners here today, Kirk, with NAMI, the National Alliance on Mental Illness, and I'll ask him if he wants to say a few words, but we're so connected related to what it takes as a community to thrive, to be healthy in mind and body, and so I think that is incredibly important. And what sticks with me also is that, we all, and you all talked about this, commissioners, how we all face challenges. And, there's different connections and help, along the way to get us to where we need to be. And I cannot be prouder of my team on a consistent daily basis for overcoming numerous challenges with the work we do. And we're all about care and compassion. And the values of the health department are integrity, service excellence, innovation. We're data-driven, and we're also respectful. And every team member that you see up here practices that, 24/7, day in and day out, because we are a 24/7 organization. We are the first accredited health department in the state, and we are the first re-accredited health department in the state. We have a high-performing public health agency that demonstrates that through the results that we provide, and also in our community health indicators report. So we have a health department that this community can be very proud of. I want to say that we have a 9-member Board of Health, where we have, as you know, Commissioners Bremer and Gonzalez on our Board of Health. We also have representation from the City of Colorado Springs, other municipalities, and other roles. We do have our President of our Board of Health, Dr. Jim Turbush, and I'll ask him to see if he wanted to say a few words as well. And we're thrilled to be here today. And there's so many more that are not able to be here. But I did want to just go down the line and recognize my team. Deanne Ryberg, Deputy Director. Michelle Hewitt, now newly married, Byerly, and she's our Public Health Information Officer. Joyce Salzar, she is our Community Coordinator, works heavily in the southeast portion of Colorado Springs, and you're also playing a dual role because you are newly elected to the Harrison School District Board, so congratulations on that. Teresa, and how do you pronounce your last name? Basma. She is with our youth substance use reduction program, Communities that Care, and we focus in the city of Fountain, Colorado. And refresh my memory, and Melissa, and she is our program manager with the Women's Infant and Children program. Kirk is with the National Alliance on Mental Illness, and within our Community Health Improvement Plan, that is one of our top priorities, is to reduce the incidence of poor mental health days, substance use and misuse. We have Heather Graves, our Community Health Promotion Division Director, and you are a program manager of the Maternal Child Health, and I apologize. Emily Mayman, my memory's not as good these days. And then we also have our formerly known as Teen Suicide Prevention program. You all, thank you, have funded this position because you know how important it is. When we were hit very hard in 2014, we've renamed that position to be more strength-based, so now it's a youth resiliency position. And refresh my memory too with your name? Brittany. Brittany. And then we have Kat McGarvey, who is with our environmental health division, and she serves as our water quality program manager. We issue one of the highest numbers of on-site wastewater systems in El Paso County. We're seeing a 10% increase from year to year, and last year was nearly 700, and we're strong. This year too, it's on track to still be a 10% increase, and we have Brenda Heimbach, who is our Health Services Division Director, which that falls in Women's, Infant, and Children and Nurse Family Partnership. There's many different programs that she oversees, and one of our highly supportive agency that we could not do our work without, and that was recognized earlier today within the response to the fires. Lonnie Eisner, did I pronounce your name right? Insner? Inzer. And Lonnie is, you all know him, but he is the Deputy Emergency Manager with the Office of Pikes Peak, Office of Emergency Management. So he's another partner, strong partner of ours. Yeah, we're part of the team. And then I see you over there too, and I've talked about the Medical Reserve Corps numerous times, and what a phenomenal support that they provide to first responders and public health, and all of the work that you've done in the volunteer hours. I know that the costs associated with the volunteer hours are well over $1 million. So thank you for that. I will ask if anyone has anything to say, but I'd like to call up our Board of Health President, Dr. Jim Turbish, if you wanted to say a few words, and then Office of Emergency Management and NAMI, if that's okay, Commissioners.
Jim Turbish, Board of Health. Thank you, Commissioners, for your continued support of our county public health department. My dad taught me never miss an opportunity to say thank you. So let me just say thank you, particularly to our two Board of Health members who are up front on the dais, and the leadership of our public health department, Director Susan Whelan and Deputy Director Deanne Ryberg. Thank you so much. And to your leadership team, to our partners, we couldn't do anything without our partners. But most importantly, I'd like to recognize the public health staff. And Susan's already told you about the long hours, but how skillful and innovative and just smart and wonderful they are. So thank you, public health staff, all of you, for the wonderful work you do. And what a great proclamation today. Thank you.
Thank you, Doctor. Good morning, Lonnie.
Good morning, Commissioners. Thank you for having me here today, and also Susan and Deanne, thank you for asking us to come today. It was a privilege for the Office of Emergency Management to be a part of public health for the COVID response the last couple of years. Very much a privilege. We learned a lot. The staff in public health were fun, interesting. It was a learning experience for all of us, and we really do thank public health, Susan, Deanne, Dr. Turbush, and previously Dr. Johnson too, for all the help they gave us so that we could assist and help and provide what was needed. We are a part of public health. Thank you.
Thank you.
Good morning. I'm Kirk Woundy with NAMI Colorado Springs, the National Alliance on Mental Illness. Just want to thank you for having us here today. As has been said a couple times, all of us are going to face challenges in life and do face challenges in life. And at NAMI, we try to help people answer those challenges when they're of the mental health variety. But we are just a very, very small part of a much larger system. And we are incredibly grateful and lucky, I think, that at the forefront of that system is this team at El Paso County Public Health. So thank you for having us here today, and thanks for considering this proclamation.
Thank you. I'd also like, if there's any member of our team, you're welcome to come up here too.
Now's your chance. There we go.
Thank you. Good morning, Commissioners. Deanne Ryberg. I'm the Deputy Director at El Paso County Public Health. And I would just like to take a moment to thank you for this proclamation, recognizing not just the work of our agency, but also our partners, because so much of our work is done together in collaboration. And I would also like to say how privileged I feel to be here this morning for this very inspiring meeting, starting the meeting with the invocation, talking about finding the right path, even when that's not clear. Something I know our team has worked hard over the last 2 years in many challenging situations to find that right path forward. And also the commentary about public service, as well as hearing those inspirational stories from our community's youth. This is truly a uplifting meeting to be part of. I thank you for the recognition of our team. And again, thank you to all the staff who have made the wonderful work of public health and the community partnerships that we celebrate possible. Thank you.
Okay. Well, there's many more that might be listening online or at work today at local public health. So I just am tremendously proud of my team. They are all leaders, and they've contributed so much to improving community health. So with that, I think that concludes.
We'll bring this up to the dais, and I'll ask for any comments from any of the commissioners. And again, because Commissioner Bremer read this, we'll close with her as well. Okay. Commissioner Williams.
Yes, I wanted to thank all of you for being here. I was writing down a few things. That public health is where you are, thriving in a safe and stronger community, and health is also an individual responsibility. I have just been so thankful for all that you have worked so hard in the past 3 years or 4 doing. It's been a very stressful job, a very tough time for all of us as we went through the COVID pandemic. And we're looking forward to somewhat a return to normalcy, we hope. And Dr. Turbish, thank you for your leadership. I really appreciate the Youth Resiliency Department. I was such an honor to learn that as early as 2014, between our county coroner, Leon Kelly, and many of you all noticed the rise in teen suicides in Colorado Springs. And you pulled together a team of faith-based and school-based partners, as well as many nonprofits, to help address that. It's still an issue, obviously, that we need to look at all the time, and I don't think that COVID helped it any, but we're looking forward to getting those programs back on track and working with our children and our youth. I also appreciate our on-site wastewater system evaluations as we continue to grow, Catherine. We appreciate your hard work and effort in those. And Deanne and Michelle, we appreciate all the communications we get from you and stepping forward to help us for a few months. Deanne, thank you. I did want to mention in just Dr. Robin Johnson's help, I'm on the chair of the Criminal Justice Coordinating Council, and her work on the Behavioral Health Committee with us was fantastic, and she is greatly missed. And there's many issues in criminal justice and behavioral health, and as we try to find the path forward, we look forward to continuing to work with our many partners, including the health department, on finding that solution. But most of all, I wanted to thank Director Whelan for all of your hard and wonderful work. We know that you've had your own adversity in the past few months, and your health team was able to continue on and work very hard. And we just know that you've been a fantastic leader throughout this time, and I wanted to personally thank you for all the efforts you've given to us. Thank you.
Thank you, Commissioner. Other comments from other commissioners? Yes, I think I see Commissioner Geithner. You have your hand raised. Please proceed.
I do. Thank you, Mr. Chair. So I appreciate the work that is done by all of our county employees, and particularly it has been a rough couple of years for certain. I certainly have appreciated much and have also been vocal about things I didn't appreciate. And so I believe in truth and honesty, and I also very much believe in having conversations that are for our entire public. And since this is a public meeting, there are a couple things that I do need to mention. So the first thing is I worked on and support everything that is in our proclamation today. But I know that there are some concerns in our community about National Public Health Week in general. And so I want to just clarify a couple of things on the record and for folks who may have those concerns. It is true that National Public Health Week, the organization that oversees that, does a lot of things I don't necessarily personally agree with. In pointing a couple of those things out, there is an emphasis on the daily themes of racism being a public health crisis. There is also health is a human right. We have a day that was set aside for climate change, and some of the fact sheets say things like galvanizing climate justice. So I want to be clear that our proclamation today is very specific about its words, because those are not things that I think are helpful or supportive. I think that they are a political agenda that actually weakens the real work of public health. And so I just want to point out today that this proclamation and what we're doing here is not the same as what the National Public Health Week organization puts out, that we have a much different view that puts an emphasis on individual health and responsibility. And so I'd like to thank our public health department for focusing on those things specifically and not delving into the political agenda that is, in my mind, weakening public health and that our community has concerns about. So thank you for your work. And that's all I have. Thank you.
Great. Thank you, Commissioner, for your comments. Commissioner Gonzalez.
Thank you, Mr. Chair. I wanted to thank the team and all the employees, as was mentioned, for all the hard work you've been doing. You know, and the things I remember when I first joined the board 5.5 years ago, almost now, the Board of Public Health was what we had seen with suicide, youth suicide in particular, and the things, as we're mentioning here, there are so many different things that public health does, and the suicide prevention and efforts have reversed that very negative trend 6 years ago, 5 years ago. And then also some of the other stuff, particularly in my county district area there on the southeast side, where we do see expectant mothers and WIC and the people in need there for their children and for the mothers, being able to provide them services. Substance abuse, we mentioned that earlier as well, and it's highlighted even more so, as I've asked many times in our the last months, if not last year, is like the fentanyl crisis that we're seeing. How do we do that as a community and as a public health entity to address the needs for our community? And we continue to see the climbing death rate, as particularly amongst fentanyl, and that's just several of the different things and aspects that and broad range of what public health does. And so again, thank you to the team.
Great. Thank you, Commissioner, for your comments. And my comments, I just want to thank my two fellow commissioners for sitting on the Board of Health, the El Paso County Board of Health, for all of those board members and for all of the entire Board of Health team. We certainly have had a tough couple of years, but I want to express my appreciation to the partners and specifically to our Board of Health, the staff, the board members, and everybody, and the leadership, because you focused on education in an environment that was really, really tough to deal with. And there were an enormous number of things there where the pathway going forward was not clear. It was difficult to see what that pathway was. But during all of that, you focused on education. And what does that mean? That means that when a company came to you or an association came to you saying, what do we do? How do we protect our citizens and stay open and deliver services? You worked with them and you helped them figure out something that was comfortable for them so that they could continue to do their job. And I know that you did that with hundreds, if not thousands, of companies and associations, and that was essential for the economy in El Paso County to survive. You know, when we had the lockdowns, we worked on an enormous number of waivers to get the economy reopened, and you played a key and critical role in that. And as a result of that, you know, there's a lot of things that we just won't necessarily talk about. But people were able, by and large, it wasn't with every person, but by and large, people were able to keep their job or keep some kind of a job where they could produce their own resources to deal with the challenges in their families. It also produced an environment that allowed our economy to come back very, very quickly. And I'm very proud to say that our economy today has more people employed in it in El Paso County than prior to COVID. I find it also amazing, and you can correct me if I'm wrong, but if I understand correctly, during 2020, at the height of COVID, at the end of that year, even though we had restaurants that had been suffering and a lot of those owners had put their life savings into their companies to stay alive, we actually had more restaurant licenses at the end of 2020 than we had at the beginning. If that isn't a testament to the resiliency of our economy and the work you all did to help us get through this, I don't know what is. And I think as we come out of COVID, we have to think about all of the other great services that you all have been providing for decades, quietly to citizens. And these are things like mental health and restaurant safety, child health, family planning. I went on the website and found out you even actually provide information to citizens that go on international travel and let them know what kind of health risks they might be facing when they travel overseas. You work on food allergies. You work on interpretations of nursing law. Isn't that interesting? You help in dealing with ensuring that septic tanks are safe. You deal with animal bites and rabies, radon testing, tuberculosis issues, and water testing throughout our community. An enormous number of services that I think often go, you know, unrecognized. And certainly they were not thought about much during the challenges that we had with COVID. That seemed to be almost the singular focus. But there's so many other things that you all continue to do and will continue to do to ensure that our economy and our citizens are in a safe and healthy environment. And I just want to express my personal thanks to all of you for doing all of that. You all did a great job in managing something that was so tough for everybody. And those are my comments. And now we will hand this over to Commissioner Bremer.
Thank you, Mr. Chair. You know, I think it's significant that while some of the comments here today have been related to COVID, I think it's incredibly significant that we are here today with a National Public Health Week proclamation that actually made no mention of COVID. And I think that that it's important to recognize, and we will continue to recognize the hard work that went into that, the hard work that our entire community is continuing to recover from, but that for the community to realize too that all of that work that you did on that is but a piece of what public health does on a regular basis. The infectious disease and the emergency planning pieces that became very prominent during the last 2 years are but a piece of what public health does. And so I'm very excited that that all of the other things and pieces that public health does for this community are highlighted. And I am excited about that. You know, for each one of you here, I know that there are other employees behind you and around you that are not here today, and I can look each of you in the eye and give just a heartfelt thank you. Thank you for your service, because that's what you do for our residents, for our community every day. And I hope that you can take that message back to those who aren't here as well. And then, because you're public servants as well, just as well as any of us that are elected. And you take that job seriously, you handle it professionally, and I'm very proud of that. You know, I'm going to say something that I'm pretty sure I almost said verbatim to our iInspire Award recipients this morning, but we're here to celebrate you. We're here to celebrate your hard work. It takes an entire team, a support system around each of you, and I'm proud of you. And it is appropriate that this morning's stories and young people who have their own inspiring stories realize that so many of the different things we heard, recurring themes in some of those stories, are what you all work on for our entire population each day. And I think it's a beautiful thing that you can kind of stand in front of us today to be celebrated, but also I hope that you're internally taking note of the individual stories that do get impacted by larger work. And so I'm very proud to vote for this proclamation today. And Susan, thank you for your leadership. Dr. Turbush, thank you. And thanks to all of you.
Great. Thank you for your great comments, Commissioner. Are there any last comments or questions from any of the commissioners before we proceed to a vote? All right, seeing none, let's do so. Let's proceed to a vote. Commissioner Williams.
Aye.
Commissioner Geithner.
Aye.
Commissioner Gonzalez.
Aye.
Commissioner Bremer.
Aye.
And the chair votes aye. That passes 5-0. Congratulations to you all and the team. Let's take a brief recess for a few photos, and again, congratulations.